Health news now. A new study shows potentially life-saving blood transfusions during surgery might actually do more harm than good.
Yeah, that's why at least one local hospital in South Florida is now offering so-called bloodless surgeries that combine special tools and techniques to speed up the recovery. CBS 4's Dr. Sean Kniff explains how it works.
56-year-old Robert De La Pena knew something wasn't right in his body.
Having high blood pressure, I was also having very bad irregular heartbeats, mood changes.
His doctors found 3 tumors in his abdomen, and one of them was wrapped around a major artery. The surgery would be risky and more complicated since Mr. De La Pena is a Jehovah's Witness.
As a Jehovah's Witness, that I would have to have surgery, a bloodless surgery.
He's not alone. Bloodless surgery is one of the fastest growing fields in medicine. By using special techniques, doctors first expand a patient's own blood volume and then use special tools to prevent blood loss.
It's a growing trend, definitely, across the country.
Gabriel Alvarez from Baptist Hospital, one of the bloodless surgery centers in South Florida, says this transfusion-free surgery leads to fewer complications, less inflammation, better results, and quicker recoveries, even for major surgeries like cardiac bypass.
And definitely showing some better outcomes for the patients.
Plus, blood banks are constantly in short supply.
Some hospitals actually have had the need to cancel surgeries because of the lack or the availability of blood and blood products.
Mr. De La Pena says he's living proof bloodless medicine has its benefits.
It's something that I think it's the wave of the future.
Now, for trauma cases, practicing bloodless medicine can be a real challenge, and sometimes it's just impossible. But under other conditions, the human body, believe it or not, can lose a fair amount of blood, about 20% of the total blood volume, before any of your organs start experiencing some major problems. So, human body is quite a remarkable thing.
And it's good news for some folks who don't do it for religious reasons.
It really is. I mean, this has implications that exceed religion. It started with religions. The Jehovah's Witnesses were pioneers in treating Jehovah's Witnesses in bloodless medicine, but certainly it actually might have implications for everybody out there.
Okay, thanks. Helping a lot of people.
It really is.
Thanks, Dr.
The News 4 troubleshooters are breaking big medical news tonight. We have learned San Antonio is about to get its first bloodless hospital.
Now that means it'll be performing surgeries without giving blood transfusions, in part because blood is always in such short supply in our area. Troubleshooter Jay Avila has the exclusive details on something many patients didn't realize was even possible.
Blood transfusions are standard practice during many surgeries, but now one local hospital says it can perform even complicated open heart procedures without transfusing any blood. They say it is safe, less expensive, and the patients recover faster.
Northeast Baptist Hospital says this is not a medical trial. It's converting the entire hospital into a bloodless facility with the goal of performing 90% of its surgeries without blood. How is that possible? Take the case of Raymond Talbert, who is legally blind and needs one of his heart valves replaced or he could die. Raymond cannot receive a blood transfusion because of his religious beliefs.
Because I'm a Jehovah's Witness, I do not take blood. And so they recognize that and they respect that, and that pleases me immensely.
In the days before the surgery, Raymond's surgeon, Dr. Jerry Kelly, tries to conserve Raymond's own blood by drawing as little of it as possible for testing.
In the past, you would take a big tube of blood. Now we're using very small tubes. And basically every test that we're ordering now, we're thinking, do we really need this test? Or can we go by the results we had yesterday?
Raymond is also given iron and a special drug to build up his blood cell count in advance of the surgery.
My faith is strong. I have no questions about doing it this way, and the technology is there to do it.
While performing the operation, Dr. Kelly cauterizes blood vessels as he goes to minimize bleeding. What blood is lost goes into a special machine called a cell saver, which filters Raymond's blood and routes it directly back into his veins. They also dilute Raymond's blood with a saline solution to increase the volume of blood in his body. Bloodless hospitals in other parts of the country have been using these techniques for years.
This is nothing experimental. These are procedures being done other places.
Northeast Baptist hopes by going bloodless it will no longer have to delay or cancel surgeries due to a shortage of donated blood. And the move could save the hospital hundreds of thousands of dollars a year. Just 1 unit of donated blood can cost a hospital more than $700. By the time the hospital matches the blood and does the transfusion, the cost to the patient can jump to $1,500 or more.
It's cheaper all the way around. The hospital bill is going to be less. You have a less chance of having a problem with the blood, and you heal faster. You heal better.
Oh, I feel great.
That seems to have been the case with Raymond Talbert. He was able to leave the hospital 4 days after his heart surgery. Northeast Baptist says other patients who received the same procedure with blood transfusions spent 15 to 22 days in the hospital. The average cost of a heart surgery without blood is about $16,000. With blood transfusions, the same surgery costs about $23,000.
I feel good about it. I feel positive about it. I'm physically well. I'm alive. I'm not doing any marathons today, but I'm here.
Doctors will still have the ability to give a blood transfusion if they feel it's medically necessary or if the patient asks for it. But when patients check into the hospital now, they'll be automatically told about the benefits of having the surgery without blood. I'm News 4 troubleshooter Jay Avila.
Jay also talked with another heart patient who had no religious objection to getting blood or blood transfusions. But that former firefighter said he's more concerned about possible infections or complications from receiving donated blood.
When a North Jersey hospital looked for ways to serve a Jehovah's Witness community whose religious beliefs don't allow it to accept blood, it turned to pioneering what was then an emerging practice, bloodless surgery. Now, that was 15 years ago. Today, bloodless surgery is the norm at Englewood Hospital and Medical Center, where of 15,000 procedures a year, fully 95% are bloodless. NJN News health and medical correspondent Sarah Lee Kessler has the story.
We'll use a cell saver now.
When it comes to bloodless medicine, Englewood Hospital is considered a world leader. For years, its bloodless approach has been used for everything from gastric procedures to cardiac bypass surgery. Proponents say going bloodless promotes healing, reduces infection, and saves lives.
The results that we have, which is the lowest morbidity or mortality in cardiac surgery in the state, is associated again with the lowest transfusions rates that have been published so far.
The lowest transfusion rates, not just in New Jersey, but nationally and internationally. Dr. Aryeh Shander is founder and executive medical director of Englewood's Bloodless Medicine program.
We've had patients come from 42 states in the United States to get care at Englewood Hospital Medical Center, and we've had patients coming from 45 nations outside the United States to get care here too.
Some, like Jehovah's Witness patients, choose the bloodless approach offered here for religious reasons.
Throughout the Bible, God tells us not to take blood, so I follow that.
In the operating room, instead of blood being transfused, it's collected and recycled. The blood that is lost during surgery at hospitals like Englewood is suctioned out by a cell saver machine, and then it's cleaned and returned to the patient's body.
And so the patient really becomes their own blood bank.
Sherry Ozawa is the director of Englewood's Bloodless Medicine program.
Medical literature shows that about 60% of the time, patients receive blood for no good reason.
Transfused blood, according to Ozawa, can lead to serious complications.
Increased risk of death, increased heart attacks, increased strokes, increased ICU stay. And that really doesn't matter if it's your own blood or someone else's. That blood is not the same. Once it comes back out of that fridge, it's not the same as it was when it went in. It does not pick up oxygen very well. It does not drop off oxygen very well.
People who care about this issue should make sure to carry a no blood card. Sarah Lee Kessler, NJN News, Englewood.